Children's occupational therapy provides a highly specialist assessment and treatment service for children who have movement difficulties and disabilities. Across Northern Staffordshire, we have many children who need this service. Paediatricians often refer children into the service whose movement difficulties are part of an overall developmental delay. In this case, the occupational therapy service usually gives generic advice, for example, suggesting special cutlery or recommending clothing adaptations. A highly specialist assessment is carried out before this advice is given due to historical practices. This means that specialist therapy time is being used to deliver what ought to be a targeted service. It would be a better use of therapy time to give thorough advice to these families from the outset, rather than assessing children who we already know struggle across all areas of their development. The funding from this grant will allow Rebecca to develop and test a family-centred service pathway to support children with global delays. This will direct the emphasis away from specialist assessment and towards providing the general support and advice these families need. Not only should this mean that families get a more appropriate service, but the specialist assessment time shall be released to ensure that those children who need it most can access it within acceptable timeframes.